Welcome and thank you for attending the webinar titled The Nuts and Bolts of School Reopening in the Age of COVID-19. Today, it is our goal to provide a framework for schools to reopen safely during the current pandemic. This is a slide on our general copyright. Please note that points of view or opinions in this webinar today are those of the authors or presenters and do not necessarily represent the official position or policies of the United States Department of Education, and this project is supported by a grant administered by the U.S. Department of Education. So I'd first like to start by introducing myself. My name is Dr. Jamesia Hoyle. I am a scientist and senior public health consultant with expertise in pandemic preparedness and response. I have been an instructor with the National Center for Biomedical Research and Training for the last 4 years, where I teach various courses to increase domestic as well as international preparedness for biological incidents. I have managed multiple public health program activities related to global health security, infectious diseases, pandemic preparedness, and emergency response and preparedness. My work so far has taken me to over 70 countries. I'd like to turn over to my co-presenter, Dr. Anna Long, for an introduction.
Hello, everyone. My name is Dr. Anna Long. I'm an associate professor of psychology at Louisiana State University and the current director of clinical training of the school psychology program at LSU. I am also a licensed psychologist. Before I came to LSU, I was a research associate at the Center for Behavioral Education and Research at the University of Connecticut. There, I worked alongside colleagues in the Department of Educational Psychology, who co-direct the National Education Center on Positive Behavioral Interventions. I'm very passionate about delivering results for children's, families, and schools, which led to my specialization in implementation science. Implementation science focuses on how you get the best available science and research findings adopted and implemented in practice settings so that what we know works reaches and helps the children and family that we are trying to serve. I also have expertise in culturally responsive practice and serve as one of the committee members of the American Psychological Association's Committee on Ethnic Minority Affairs. My research in culturally responsive practice examines how we can extend access to scientifically based interventions to marginalized groups, as well as how to identify and tailor the delivery of practices to diverse communities. Over the years, I've supported many teachers in schools across multiple states, and most relevant to the training today, I work supporting schools with their crisis preparedness and response, especially in the state of Louisiana.
Thank you, Dr. Long. So for the purpose of the webinar today, it is actually broken into what I would consider 2 parts. So in the first part of the presentation, I will be leading the discussion, and these are my following objectives. So first, I'm going to talk to you about what is COVID-19, and so we'll talk about the routes of exposure, signs and symptoms, and then we'll move into a discussion of the current COVID-19 situation in the state of Louisiana. And then I will start to explain to you the phased approach to address COVID-19. Next, we will look at some of the recommended public health strategies for each phase of addressing COVID-19. Next, I will describe the recommended public health strategies for positive COVID-19 tests in the school environment. And then lastly, I hope to reinforce the key principles to reduce COVID-19 transmission, both within the school environment as well as your local community. So I would like to note that the information provided in this webinar is based on the best available science and regulations at the time of this recording. As more information on the novel coronavirus becomes available, it is important to be ready to make changes. As such, I encourage each school environment to maintain a relationship with the Office of Public Health and your local health agency. All right, so let's get started. So I know that you've all heard in some form or fashion COVID-19. You may have heard different names, coronavirus, SARS-CoV-2. They're all really referring to the same thing. COVID-19 is actually short for coronavirus disease 2019. So this is the naming structure given by the international community. It is actually a new respiratory disease, which is currently spreading around the world. And this is why we call it a pandemic. It is caused by a coronavirus, which is SARS-CoV-2. Now, you would actually probably be surprised to know that we have had previous coronavirus outbreaks. In 2003, there was an outbreak and it was called SARS, Severely Acute Respiratory Syndrome. It spread to more than 24 countries worldwide, and it really caused sickness in about 8,000 people. So you can imagine just the scale compared to now, how many cases that you're hearing on the news on a daily basis. In this outbreak, over 700 people died, and there were 8 travel-related cases here in the US. So considering it was a much smaller scale, but in terms of pandemics, this is the first outbreak of a coronavirus that we've seen with pandemic potential. Moving on a few years later to 2012, we had an outbreak of Middle East respiratory syndrome, and it first was reported in Saudi Arabia, likely transmitted from camels to humans, and then it quickly spread throughout the Middle East, and eventually travel-related cases started to show up in South Korea, where it reached pandemic potential, or at least epidemic potential in South Korea with the number of cases there. In the US, we did have 2 travel-related cases, so I think these were actually 2 cases that had been to the Middle East and returned to the US. It is believed that the current outbreak of SARS-CoV-2 or COVID-19 started in Wuhan, China, in the live animal markets. And as of this presentation, the World Health Organization is working with China to start an investigation into the origins of the disease. So let's look next at how COVID-19 is actually spread. So this is going to be really important to have this conversation and this basis of understanding to really know why we're putting these particular public health strategies or public health measures into place. So it's spread generally between people that are in close contact with one another. And so that is why we have the recommendation of making sure you're maintaining physical distancing of 6 feet. So the routes of transmission, first we have droplet transmission. This is the known route of transmission. And this is when you have contacts with particles that are usually larger, but are produced from coughing, from sneezing, or even talking. We also have contact as a route of exposure. So think about any touching of surfaces and also shaking hands. So contact as a route of exposure will be anytime you may contact a surface, a person, or an object that is contaminated by COVID-19. As we're starting to learn more about the disease, we know that there is also transmission via airborne, via fecal oral, bloodborne, mother to child, and animal to human transmission. We're starting to learn more about that. So I can anticipate over the next weeks or months that you'll start to hear more about this as a route of transmission. Just to give you a little bit of understanding about the difference between airborne and droplet transmission. Airborne transmission is usually transmission of very small particles that can stay suspended in the air for much longer periods than your droplet transmission. And these can be produced just via normal breathing. One other thing to note, people are generally most contagious when they are sick, but In the case of COVID-19, we have noticed more data on pre-symptomatic and asymptomatic people. So pre-symptomatic is people that are infected with COVID-19 but have yet to show symptoms. Asymptomatic people are people that are infected with COVID-19, but they do not show any symptoms. Both of these populations can still pass the virus to an individual. Next, we can look at the symptoms of COVID-19. So we have this nice graphic here from the Center for Disease Control, which really shows you the signs and symptoms that you can look for. So you can take a look at the screen. What you'll notice is most of them are basically what we would experience with cold and flu, even seasonal allergies. It is critical to understand that anyone can have mild to severe symptoms. Older people, older adults who have severe underlying medical conditions like heart and lung disease or diabetes seem to be at a higher risk for developing more serious complications from COVID-19 illness. Other symptoms that are not listed that we're still learning more about is fatigue, general just tiredness, headaches, congestion and runny nose, nausea and vomiting, and diarrhea. As the CDC learns more, they will continue to update this list about the signs and symptoms of COVID-19. As you are considering COVID-19, we do have what we call emergency warning signs. So if someone is experiencing trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or to stay awake, or bluish lips or face, it is recommended at that point that you call 911 or your local emergency facility. So it's very important to note that you should call ahead before going to a facility, just because most places have procedures in place that are noted for your arrival. Now let's take a look at the information on COVID-19 for the state of Louisiana. So this information is updated on a regular basis. You can look it up on the Louisiana Department of Health website. And so what I have here is a screenshot that really captures the numbers of cases in the state. And so what you'll see is this data is as of July 20th this year. So you see the number of cases in the state, how many people have died in the state, how many people are presumed recovered from COVID-19, how many tests have been performed by the state lab, and then additionally, how many tests have been performed commercially. And then lastly, you see information on COVID-19 patients in hospitals and how many are on ventilators. So this really gives you a nice overview of the current situation in the state, but also some of the resources that may be needed or that are being expended at the state level. Now let's move into a discussion of the phases. So I'm going to approach this from 2 points of view. I'm going to approach it first from the point of view of the phase reopening guidance at the national level, which comes from the White House, which the state of Louisiana is following very closely. And then I'll go into a more detailed discussion about the phases for reopening schools, specifically from the Strong Start 2020 document from the state of Louisiana. So first, as we look at the phases of reopening America, we'll start with phase 1. And so I'm going to briefly go over the phases on the individual level, looking at employers, and then looking at some just general other considerations. This more detailed document is actually available through the White House if you're interested. And then you can also check the state of Louisiana to see specifically the guidance from there. In phase 1, this is the most restrictive level. This is where we have the highest level of community spread of COVID-19. You can imagine the measures taken are very strict. So we have all vulnerable populations should shelter in place. We want maximum physical distancing in public. And of course, now because you understand the transmission of COVID-19, you know why we're doing a 6 feet distance. We want to limit the gatherings to 10 people or less. So of course, in this environment, you'll understand the more people that you interact with, the higher the likelihood that they may be infected with COVID-19, or they could be an exposed contact, or they could be pre-symptomatic or asymptomatic. So just making sure that we're taking the necessary precautions to keep the cases low. In this first phase, we are minimizing non-essential travel, so it should be as low as possible. When considering employers, for the most part, we are encouraging telework. You want to make sure that if people are returning to work, that it's in phases, really limiting the amount of people that are in buildings. Any common areas should be closed to really limit gatherings of people and the possibility of transmission of disease. And just like individuals, you want to minimize non-essential travel. When you start to look at other considerations, this is just a few that I pulled out of the document. There are many more, but what you see here is that visits to senior living facilities and hospitals are strictly prohibited. We have probably seen from news reports that the seniors, and this is something that I mentioned before as well, are oftentimes disproportionately affected by COVID-19. So in order to keep those transmissions low, we just don't want people coming in and out of those facilities. Bars, entertainment venues are generally closed. If larger venues are operating, it's under very strict protocols. If you move to phase 2, so this is the current phase of the state of Louisiana, you see some very similar measures as in phase 1. Some of the changes is that you start to see larger gatherings are possible. So gatherings are 50 people or more. You do still have the risk of transmission. So I encourage everyone to keep that in mind. And then what you start to see is non-essential travel can resume. In terms of employers, we're still encouraging telework, but some of the things you may consider is as you have people coming back to work in phases, just in every phase, what are your considerations for your employees? What are your considerations for vulnerable populations that may be returning to work? In terms of other considerations, you start to see that maybe schools and organized youth activities can reopen in this phase. And so what considerations are you taking for the safety of those populations? Your large venues may continue to operate with a little bit of changes to their physical distancing protocols, but still quite strict measures in places. And some of your more entertainment-focused venues may start to reopen. So if you notice that from the state of Louisiana, in their phase 2 approach, they are taking an industry-specific approach. And so some entertainment venues may be open and some may not. This goes for the full gamut of anything within all areas of industry. And then considering phase 3, the final phase, you start to see now that our vulnerable individuals can resume public interactions, of course, really staying true to the necessarily public health strategies such as physical distancing, face coverings, etc. Low risk populations should start to minimize time in crowded environments. And here, phase 3, you can imagine things will start to reopen in a much broader way. So just making sure that you're still cognizant that even though we are in phase 3, COVID-19 could still be in your local community or places that you travel to, so there is still a risk of exposure. Employers can start to resume unrestricted staffing on work sites, so you may see the common area open just like the individual perspective. Keep in mind, COVID-19 could still very much be circulating amongst the population. And then in just terms of other considerations, your large venues may start to operate under limited physical distancing protocols, but still keeping in mind what we are all calling the new normal. And things like gyms may reopen. Most things will reopen, but they have a new standard in what would be the sanitation protocol. So really infecting or disinfecting surfaces and just making sure that things are clean. Now we're going to go into a more detailed discussion of really looking at the phases under Strong Start 2020 and the school population. So we'll look first at phase 1. I think you'll notice as you're looking at the phases that it's very similar to the government or the White House guidance or what the state of Louisiana may be using for a general perspective. But there are a couple of differences, and so I'll point those out. In phase 1, what you see is maximum group sizes. And so across each of the phases, please note that your group sizes are including any adults. So you have your students, but also taking in consideration the adults that are with that group. Phase 2, it's 25, including adults. If you remember from the overarching guidance, it was 50. And it's in phase 3 where you actually move to the 50. And so in the government standard guidance, this was actually an under-restricted, but it's not unrestricted in our school policy. What you see across the phases is that younger students, when possible, you want to maintain static groups, keeping them together in order to limit the exposure. And some of the reasoning behind this is that they may not be able to wear face coverings, they may not be able to social distance, so you may come into close contact. So you want to make sure those groups are limited to really reduce the risk of transmission of the virus. With older students, if students are able to maintain physical distancing, then those groups composition may change. So this is where you start to see measures in place to really maintain the physical distancing of 6 feet in the classroom or in any indoor settings. And so I'm going through the phases now, but in the next few slides, I'll talk specifically about public health strategies that the schools can take. When you start to look at physical standards, this is things like when students are convening indoors, you want to make sure that they are in rooms that are enclosed by walls or that they have some types of partitions between them. As much as possible, being able to maintain the 6 feet distance. I know it may not be possible in all classrooms, so separating as much as possible between students and other students and also students and teachers. If you are using large spaces such as gymnasiums or cafeterias as alternative spaces, you want to just make sure that you have walls and partitions in places. Also, you want to make sure that, as I mentioned with the new normal of cleaning standards, that your high touch surfaces are cleaned before and after each group's use, and that groups are separated when they're outdoors, but they don't necessarily have to have the physical barriers, but considerations for reminding the importance of maintaining the 6 feet distance. Of course, you want to limit crowding at your entry and exit points. And so making sure that people are not congregating in large groups, trying to maintain maximum group sizes and physical distancing recommendations to the maximum extent possible. This is where it may be really nice to have things like directionals, so you can envision when you go to the stores or grocery stores now, how you have the arrows on the floor telling you to go in a certain way. Those are just other measures you can take into place to really control the flow of the crowds. In terms of athletics, the state has outlined really good guidance, and they have people following these regulations very closely. In phase 1 and phase 2, you want to completely refrain from contact and high-risk sports. As you move to phase 3, you may start to see them allowed within defined groups. Moving on to symptom monitoring across the phases, the state has issued guidance for health screenings upon arrival to school. So schools should make considerations for what that looks like, and we'll talk about it a little bit more in the next few slides. Also, consider the importance of establishing an area to be used for students and staff that need to be isolated when they are sick. So you may need to have a place for people when they arrive to school that may not meet the standards of the health screenings, but also people within the school that become sick during the course of the day. Once again, the need to clean and disinfect the surfaces in the isolation area after the sick individual has gone from the school environment. In terms of environmental cleaning and personal hygiene, some of the considerations here are the same things: cleaning, especially cleaning multiple times in the high touch surfaces, having hand washing available. And so the guidance is on arrival, at least 2 hours, every 2 hours, before and after eating, before and after using outdoor play equipment, and at the exit. So you may see in your school environments or have considerations for what we call hand washing stations. And this could be simply something that is just a standalone station that has hand sanitizer available, of course, making sure the hand sanitizer has at least 60% content for alcohol or alcohol content. In terms of face coverings, adults and students 3rd grade and up should wear face coverings to the maximum extent possible. Any child over age 2 may wear them, not a requirement, but face covering should be worn in all areas of the school. So not just at the entrance and exit, but also in the classrooms. Most importantly, face covering should be worn during arrival, dismissal, and transitions throughout the school. Of course, you have considerations for those individuals with severe breathing difficulties that should not be wearing the face coverings. And there is specific guidance within Strong Start 2020 also for children that are under third grade, so second grade and lower. And then we'll look quickly at transportation. So across all three phases, it's a little bit different. And so what you see is just a capacity restriction. Phase 1, 25% capacity, which basically means one student per seat with every other seat empty, with the exception that people in the same household can sit together. Phase 2, 50% capacity. Phase 3, 75% capacity. And basically you take the number of seats on your bus, multiply by the capacity factor, and that's how you know. The only additional caveat I would say here is that you want to make sure that you are spacing between students as much as possible to try to really maximize the distance between your students. So now I will move into offering public health strategies based on Strong Start 2020 and the best available CDC and World Health Organization guidance. So the next guidance will be really for people that are moving into a scenario that offers some type of face-to-face learning. So you have three possible scenarios for returning to school. You have traditional, which would be your normal face-to-face model. You have hybrid, which is some mixture of face-to-face and virtual. And then you have virtual, which was 100% online. The strategies for the next few modules, which I'll describe, as I mentioned, will be for people that are returning either in the traditional model or the hybrid model. So as we move into discussion, I have outlined it based on the phase, and I'll offer guidance to you based on each of the phases. So please remember, phase 1 is the highest level of transmission in the community. So the transmission levels are pretty high. The restrictions are pretty strong. As you move to phase 2, you have a decrease in phase or in transmission of COVID-19, and then phase 3, an even further decrease in transmission. Please note that the CDC has outlined guidance based on the level of COVID-19 transmission in the community. Of course, it is still close and very important to monitor the COVID-19 situation to understand changes that are necessary in the school environment. It could very well be that you are in phase 3 and you need to move back to phase 2 because the COVID-19 infections are rising in your community, or even it may be state level guidance. And the same thing between moving from phase 2 to phase 1. In the next few slides, we will look at the public health measures schools can take before, during, and after school for each of the phases. And so I've tried to pull out strategies that can be incorporated, and Dr. Long will continue to talk about just how to implement them for the most effectiveness in your school environment. But there are many strategies that a school could take, so I would encourage you to continue to review the guidance that is out there in multiple reputable sources. Please remember, even if there's no community spread of COVID-19 in a community, it is possible that schools may experience COVID-19 cases. As non-essential travel rises, people may be able to go to communities that have COVID-19, or they could have interactions with people that are COVID positive and therefore may become an exposed contact or a case themselves. All schools should be prepared with a plan to address COVID-19 cases in the school environment, no matter the level of COVID-19 transmission within a community. Additionally, it's important to maintain the relationship with your local public health agency to really understand procedures for identified cases and the need for contact tracing and guidance on quarantine, as well as re-entry to school. So let's first look at what I call some of the universal practices, which are applicable to all of the phases. First thing is really critical, and that's establishing a COVID-19 point of contact. So Dr. Long will go into this a little bit more about the structures of these teams that you can establish within your school. But I just wanted to hit on it here, really noting that it's critical to have this point of contact that's able to monitor both the external and internal information on COVID-19 so that you're addressing the needs of your community, your school environment as appropriate. Next, you want to understand the local situation on COVID-19. So of course, this is going to be where I keep reiterating the importance of maintaining that relationship with your local health agency. Also, I encourage you to review Strong Start 2020, CDC resources, and other reputable state resources for the latest information, not only on reopening schools and public health strategies, but also as we start to get additional scientific information on the novel coronavirus. You want to make sure that you continue to monitor scientific data on transmission and severity in children. So right now we know that there has been minimal research, but there is some things out there as schools are starting to reopen across the globe, or some schools in some cases did not close. Early data actually suggests that children experience milder symptoms than adults, and they often have a better prognosis, with deaths being extremely rare. Now, while children are not considered to be super spreaders, so that's basically someone that is infected and spreads the disease to a lot of people, it is important to note that children and young adults can be asymptomatic carriers of SARS-CoV-2 and eventually develop COVID-19. So we want to just stay up to date with the latest information on this as we start to see more cases in children. Of course, it's important to continue to assess the school's ability to maintain COVID-19 prevention and control measures. And I think this really loops back to the importance of the COVID-19 point of contact. You want to have someone to communicate what's working and what may not be working in your school environment. If you haven't already, of course, it's very important to create preparedness plans. And if you have, you want to update your preparedness plan to really look at responding and the need to prepare for biological incidents such as COVID-19. And then lastly, establishing a communication plan. So the communication plan will be an integral part of the success of responding to COVID-19. I think not only do you want to consider the communication plan internally to your school environment, but also externally to stakeholders and externally to the larger community and the families. Some more of the universal prevention strategies, which are applicable to all phases and encourage a healthy environment. These will be critical to reducing virus transmission across the board. So first, we have established daily health screens. So as I mentioned before, this is actually a requirement under the state. So I did a little bit of research to just see what is the standard right now and what are schools doing or considering doing. Some schools have already started to pilot the daily health screens with their teachers and staff. And then as they get more comfortable with things like electronic apps or some type of electronic form of capturing the data, and some are using paper, then they are moving to actually daily health screens of students. So I think it's important just to note that these daily screens should happen upon entry into the school environment in order to reduce transmission of people that may not meet the criteria for entering to the school. Another measure is to enforce hand hygiene. So we've repeatedly heard over the last few months the importance of washing the hands. Of course, you can use soap and water, you can use the hand sanitizer at the appropriate levels of alcohol content, but just making sure that one, you're washing the hands for at least 20 seconds vigorously, but also the considerations for washing them, upon arrival to school and every 2 hours and basically after any other activities. So we've talked briefly already about the use of cloth face coverings. So I think the guidance is 3rd grade and up for the state of Louisiana. And of course, you want to have your considerations for younger students and the staff in those environments, and also just considerations for those who are immunocompromised. As we all know, I think the face coverings are something that they take a little bit of getting used to. So I think with the guidance given by the state currently, it's going to be critical to communicate with your families the requirement or the need to wear the face mask so that the younger populations can start to get used to wearing those for extended periods of time. Next, we have guidance to intensify cleaning and disinfection. So as I mentioned, this will be the new normal. Cleaning products will be everywhere just to make sure that we are really reducing the spread of transmission through contact transmission as much as possible. So what we look at here is just making sure that high touch surfaces, including bathrooms, are cleaned multiple times per day. And then anything else like just considerations for desks and things of that nature to the extent possible, especially between your static group use. Next, we have the use of signs and messages to reinforce protective measures. And so Dr. Long will get into this a little bit about being a strategy also for implementation science and really encouraging the uptake of new behaviors. But what I would say here is that you want signs that emphasize and reinforce things like your face coverings. You want signs that reinforce the proper ways of hand washing and the needs to hand wash, and also physical distancing. This would be a really great opportunity to implement what I mentioned before about traffic flow directions and spacing, things of that nature. Modifying layouts, barriers, and guides. So I mentioned this before, and this is really making sure if you're indoors that you have the walls and partitions. If you're using the larger spaces, that groups are also spread out, and also using walls and partitions as much as possible, maintaining the 6 feet distance in the classrooms, and then any other guides throughout the building. And then lastly, to close communal spaces or stagger their use. So we talked about this a little bit in the National White House guidance. It's no different for the schools. You want to make sure those areas are closed, especially when you're in phase 1 and phase 2, and even potentially phase 3, so that you're not encouraging congregation, encouraging large groups, because we know the larger the group, the higher the probability of transmission of disease if someone is infected. And another alternative, if you're not going to close those communal spaces, is to stagger their use. Once again, same strategy, just making sure you have minimized the number of people that are congregated. And then lastly, maintaining adequate supplies. So school employees must be provided with adequate access to hygienic supplies. I think this is an important point to really think about your relationship with your Office of Emergency Management, or even people in industry that may be providing supplies to schools. So just making sure that you always have a ready supply of what you need to maintain public health measures throughout the school. So let's start to look specifically at the phased approach and public health considerations for each phase. As I mentioned before, I think there are several public health strategies that you could take for each phase. I've tried to pull out some that I consider to be most important, but you can also check the Strong Start 2020 for resources and guidance, the CDC, as well as the World Health Organization. So as I mentioned before, phase 1 will be your area where you have the highest level of community spread of COVID-19. And so not only should you consider this if you are in phase 1, but if you may be in another phase and have to move back to phase 1. In this phase, there's a high probability of COVID-19 in the school population. So you may have positive cases. You may have people that are what we call exposed contacts. So they have come in contact with someone that is positive for COVID-19, or those that simply require isolation for other reasons. Because of this, it is important to work with your local health officials on courses of action. What is the appropriate course of action to take to minimize the risk in the school environment if you are in the traditional or hybrid model where you're meeting face-to-face? Next, as much as possible, especially with the younger students that may not be able to practice the social distancing measure or wear the face covering, so those what I call universal prevention strategies, try to establish your small static groups to reduce the spread of disease throughout the school environment. Next, you want to think about your protections for vulnerable populations. So you have students who may not be able to wear masks, you have students with underlying conditions and other issues. And so you want to just make sure that you're thinking about protections for this population. And so there is guidance available for maybe various isolation measures that can be taken, or just considerations for working directly with the families to make sure that they are most protected given the threat of COVID-19 infection. And then lastly, you want to think about the enforcement of both your HIPAA and FERPA protections. So HIPAA protections will likely be covered under the Office of Public Health or your local health agency. So this is given any high-risk cases or exposed contacts that you have in your school. Of course, there will be direct contact with the Office of Public Health and contact tracing and making sure that those who have been exposed are aware. And so just making sure that those HIPAA considerations are followed, but also making sure that from a school protection perspective, when you have FERPA protections, you're also making sure that you're following all the guidance for that. So not only should these be conversations within your school environment as you're planning to return to school, but just making sure that this information is adequately communicated to your families. Some additional phase 1 considerations are considerations for extended school dismissals. Right now, CDC has guidance that says if you have an issue in your school, so you may have positive cases, large amounts of exposed contacts, or other measures that require extended school dismissal. At a minimum, they're recommending 3 to 5 days of dismissal. And then once you have a better understanding of the situation, maybe some conversations and communications with the Office of Public Health or your local health agency, then you may need to close for longer. If you are closing the school, just being the considerations for also counseling any large events. In any situation, especially when you're in phase 1, you just want to make sure that you're prepared to transition to the virtual learning scenario. At the end of last school year, we had to basically abruptly move to this. And now we have the opportunity to really think and be prepared what it looks like if we are open in phase 2 or phase 3, and we have to move to phase 1 where we are going to 100% virtual environment. What measures will we take? So just start to think about and have that conversation now. As you're having that conversation, thinking about transitioning to the virtual learning scenario, make sure that you have considerations for continuity of meal programs and any other essential services that are required for your student population. All right, let's move next to phase 2. So these are going to be public health considerations as we start to see a reduction in transmission in the local community. So still important to remember that you want to promote behaviors that reduce the spread of COVID-19. So those universal precautions. There may be even things from phase 1 that you still implement, but these are maybe some additional things that you should consider. As you start to have people, maybe you transition from 100% virtual and now you are doing a hybrid model or a traditional model. You start to have more people in your school environment. Think about your sick leave policies. They should be as flexible as possible, as to not encourage people to come to school when they are sick. In the same vein, you want to make sure that you are monitoring absenteeism. So you really want to have an understanding of why people are missing school, which is why the health screenings are most important. So not only is it important to have this data to meet your state and federal requirements, but from a public health perspective, understanding the reason behind the high levels of absenteeism could point to an outbreak in the school community, which will help in the public health response. Next, you want to think about students and staff who are sick and making sure that they know that they should stay home. Communicating that openly throughout the course of the school year will be critical. You just don't want people coming to your school environment and one having to turn them away, and also having considerations for home care for students who may need to stay home, and just really reducing the risk of transmission in the school environment. Next, make sure that you're educating staff and family on reporting requirements. So there are quite a few things here that I think are important to note. One is really making sure that your staff and families understand the importance of reporting if they are COVID-19 positive. Also, understanding the need for contact tracing, which we'll talk about in just a moment, but also making sure that your community, so staff, students, and their families, are aware of community health resources, including test centers. And then just overall, what is the guidance for returning to school if they have been in exposed contact, if they are COVID-19 positive, making sure that that is very clearly communicated. You want to make sure that you're educating your staff and families on contact tracing. So this will be directly through the local health agency, but at least make sure that your families are aware that if they are exposed, then they will get contacted. And I think, one, it's important to understand the larger snapshot of really the exposure rates in the state. So going back to that graphic that I showed you earlier with all the case information, that is where that case information is gleaned from. But also it's very important just from a personal perspective of really working together with the state, with the nation, and really trying to reduce the risk of transmission. And so this is how the contact tracing allows people to know that they've been exposed so that they can self-isolate or quarantine and really focus on reducing overall transmission. Next, you want to advise staff and families on home isolation criteria. So when they are staying home, how long should they be at home? If there's someone in the home that is also a case, so they're positive or they're contact, measures to isolate in the household, and then also what does it look like to return to school. Some other considerations are for those who are isolated, what resources are available for continuity of education. Next, you want to think about isolation and safe transportation of those who become sick in the school environment. So I did mention this a little bit earlier, but just making sure that you have a separate location, that you have transportation policies, whether it's through the local health agency or the considerations for families and what they should do. And then making sure that you have measures into place to clean those isolation areas once the student or staff has left that particular location. And then lastly, what are your considerations for ensuring continuity of education for anyone who is quarantined or isolated? So some people may have, minimal symptoms, or they may have no symptoms at all, but they are still required to stay home and isolate, and they may be able to continue to do their schoolwork, or they may be in a position where they continue to do virtual learning, but there may be just the opposite end of the spectrum where they are too sick to do any school work. So just making sure that you are clear on providing guidance for that. And then last, we will move into our phase 3. So we even have in this phase a further reduction of transmission. But just like I said before, this does not mean that COVID-19 infection is not possible. it is very possible because people will still be moving to other communities. People will be coming into your environment. So just making sure that you're aware that just because you're in phase 3, it doesn't mean that we no longer have COVID-19 circulating within the larger community. In this phase, I would encourage you to continue using the preparedness strategies implemented, what I call the universal precautions, and then start to think about, as you're having more events, maybe more people are returning to school, maybe you've moved to the 100% traditional model, you want to limit your crowding at entries and exits. So this is going to be very important to have maybe the hall monitors to keep things going. Still may want to consider closure of your communal spaces. I would believe in phase 3 that you may still have the health screenings upon entry. So just making sure that you're continuing to keep people moving along, continue to have your signage and messaging so that people know the importance of maintaining the 6 feet distance, because even though we're in phase 3, there is still the risk. The cleaning protocols will be our new normal, so just making sure that you are maintaining those protocols. Also make sure that you are keeping an adequate supply of any type of cleaning products that are needed. And then limiting visitors. So as you're starting to move to phase 3, remember, as I mentioned before, you may start to see your sporting events opening, maybe additional events in your school, academic events as well. And so as much as possible, you want to make sure that your visitors are also following your public health strategy. So they should also be required to, wear face coverings, undergo any health screenings, and be turned away if they don't meet the protocols. But as much as possible, just limiting visitors in general so that you're not introducing someone new to the environment that may potentially be COVID-19 positive. And then lastly, for this slide, you want to monitor any guidance for large events. As I mentioned, there are people within the state that are looking at sporting events. And then you can particularly work directly with the Office of Public Health to understand the new guidance for large events, what measures should be in place, if there are requirements for capacity limitations. So I think one of the biggest things that people have at the forefront of their mind, what I like to call the elephant in the room, is what are the steps when a student or staff member tests positive for COVID-19? So this is a potential reality. It may be very possible that you have someone in your environment that does test positive, particularly in maybe phase 1 or phase 2, when there's still levels of high community transmission, but even levels phase 3, as people start to socialize more. So according to the guidance right now for the state, the student or staff member who tests positive should not attend school until determined to be non-infectious by their doctor. I think it is very critical that each school environment communicate specifically what this guidance means. If a student or staff member is required to have a doctor's note, a COVID-19 negative test, whatever the requirement, each individual school should just make sure that they are adequately communicating what will be required for reentry to school. In addition, please note that the Office of Public Health may notify other staff or students who were exposed. So this is the contact tracing that I mentioned before. So contact tracing is very important to make sure that we are isolating or quarantining those who may be also COVID-19 positive, or they may have been exposed. And so they should be monitoring their symptoms in an isolated environment until they are certain that they are not positive. And then lastly, school administrators will work with the Office of Public Health to determine if the school should remain open or closed for a period of time. So right now, according to the state guidance and also CDC guidance, a positive case of COVID-19 does not necessarily warrant classroom or school closures. So we have the best measures in place that we possibly can, given the science and understanding that we have of the disease. And so with the cleaning protocols that are in place, it is my understanding that we can reduce the risk of an infection throughout the school environment. So I want to close with the last thought, and this is really to reinforce these three key principles. The public health strategies that I've presented today are really critical to reducing the transmission of disease throughout the school. Those measures taken will really go a long way in helping maintain a safe environment for students and staff as they start to return to school in this pandemic environment. I cannot stress enough the importance of following the following three key principles, and that is to wash your hands often, to wear a face covering, and to practice social distance. As we continue to learn more about the virus, this is really the true guidance to safely address COVID-19 transmission. So in summary, please remember that COVID-19 is easily transmissible. If you remember the routes of exposure, the most common is droplet or contact. And then we're now learning more about the airborne transmission of COVID-19. Because of the transmissibility of COVID-19, we have put in place specific public health strategies such as physical distancing of 6 feet, wearing face covering, and washing the hands. There are also additional measures that schools can take, and really it's important to recognize the symptoms and recognize the need to isolate or quarantine or even to have a COVID-19 test. So right now, incidents of COVID-19 are on the rise in the state of Louisiana as of the time of this recording. I encourage each of you to continue to monitor the Department of Health website to get more information on the current situation and to continue to work with your local health agency to understand the local transmission. Right now, the state government is implementing a phased approach to COVID-19, and we are currently in phase 2. More information will come on moving to various phases, but just remember phases are really related to the transmissibility or the number of cases in the community and how they are rising or declining. Each phase of the COVID-19 response has its own recommended public health strategies. There are several strategies. I've introduced you to some that I consider to be important to implement in order to reduce the transmission of COVID-19 as you reopen in some level of face-to-face schooling. Next, a positive COVID-19 test in the school environment does call for a very specific response, and I really recommend that schools not only think about what the response should be for your particular environment, but also work directly with the Office of Public Health or your local health agency to understand the return to school of staff members or students who do test positive, and just making sure that you're communicating this appropriately. And then lastly, please keep in mind the 3 key principles to reduce the spread of disease, which is making sure that you're washing your hands often, wearing a face covering, and then practicing social distancing. And I think these 3 measures will go a long way in not only protecting yourself, but protecting others, and overall helping to reduce the spread of COVID-19 in the state of Louisiana and larger in the national community.
Hello, everyone. This is Dr. Anna Long, and we will be starting part 2 of our training on helping to support schools with their reopening in the midst of this global pandemic of COVID-19. I will start with my objectives for part 2, and then we will jump into the content. So first, I'm going to describe the multi-tiered systems of support model that we all are well acquainted with for the most part in education. And I'm going to describe how this model that we do have familiarity with can serve as a framework for our response to the pandemic as well. Second, I'm going to explain how the public health strategies that Dr. Hoyle did a wonderful job of detailing for us, how those strategies actually fit within our multi-tiered support system that we use commonly in schools. Third, I'm going to help us understand what we can do to facilitate the change efforts that we need to mobilize fairly quickly within our school buildings. Fourth, I'm going to describe how we can integrate our academic supports, our behavioral emotional supports, and our public health strategies into a singular system that works together towards all of the goals that we need to meet within our schools. And then fifth, I'm going to describe how our broader responsibilities as a school fit within something called the incident command structure, which is a very useful framework to have awareness of, as this is the emergency management and response framework that's used by the broader community outside of the school. So to begin, I want to talk about the prevention triangle. So the prevention triangle can be very helpful for us to organize our school's response to COVID-19. And this is because this is a framework that we're very well acquainted with within schools. It serves as the basis of our multi-tiered systems of support. And it actually originates in public health. So it's a very good fit for our public health and safety strategies that we need to implement during this time. As you may be familiar, it starts out with our primary prevention. So this is our universal strategies that we use with all in order to reduce or prevent new cases or problems from occurring. And then it moves on to our secondary strategies or our targeted strategies, which are done with some in our community to help to reduce current cases. So this helps to slow down or halt the progression of problems in the early stages, or to mitigate the risk of spread if we have an individual within our school that becomes exposed to COVID-19 or tests positive for COVID-19. Then we have our tertiary level, or our intensive sort of individualized supports that are done for a few. This really helps to reduce complications or the severity of issues that we might have to respond to. And so we can think of this as really serving our most vulnerable within the school, recognizing all of the different risk factors and needs that they have, and really tailoring and individualized and intensive support to those, whether it be related to academics, behavioral emotional, or their physical health vulnerabilities to COVID-19. Within education, we often use different terms to refer to these different tiers of a multi-tiered framework. So just so that we all are on the same page about what I'm talking about, we're always referring to this multi-tiered system as a continuum of assessment and intervention, where our intervention strategies are becoming increasingly intense and targeted as we move up the continuum from all to few. And so sometimes at the primary level, we will refer to this as our universal strategies or our benchmarking from an academic standpoint. And then at the secondary level, we sometimes refer to this as our selected strategies or our targeted strategies or our strategic strategies. And then finally, at the tertiary level, we often refer to this as the intensive strategies for those that have an indicated problem and individualized need. So to help us to think about how we now add our public health support strategies to what we are always doing as a school community, you can think about it as being the prevention cone. So you have a side that is focused on your academic support strategies, a side that's focused on your behavioral emotional support strategies, and then now we're adding in our public health strategies that are going to be critically important throughout this school year. So there are these 3 tiers that we think about. As you well know, tier 1, or our universal strategies for all, is where we monitor all students to determine if they are at academic proficiency, if they're meeting our behavioral expectations and displaying emotional wellness, and that they're symptom-free from COVID-19. Tier 2 are those students that we have identified to be struggling or at risk under our universal supports, and therefore we have a higher level of intervention and monitoring that we're doing for them. And then tier 3 are those, like I stated earlier, that we already have identified have a problem or that we determine have a problem that's or a risk level that indicates they need an individualized response that's often intensive and maybe includes wraparound services. So to help us think about how these public health and safety strategies fit into these tiers that we have become accustomed to, I'm going to very quickly go over some of those that were stated earlier by Dr. Hoyle, but just show you them organized in a different fashion. So strategies that prevent the spread or prevent new cases from coming into our building are those universal strategies that Dr. Hoyle referred to. So these include our daily health screens, where we have adults and students that arrive at the building are going to get a health screening, which would include a temperature check. This also includes our hand hygiene and our respiratory etiquette. So we're wanting to make sure that we're washing our hands multiple times throughout the day, ideally at least every 2 hours. And in terms of respiratory etiquette, we want to make sure that we're teaching everyone in our building that they should cough or sneeze into their elbow or into a tissue that then gets discarded. We want to make sure that people are wearing their face coverings with recognition that those younger students under the 3rd grade may have more difficulty wearing them or using them appropriately to maximize the benefit of their use, but ensuring that we promote their use as much as possible, wherever possible, so that we can protect our school community from those individuals that are infected and asymptomatic. Ensuring that we have intensified our cleaning and disinfection procedures, especially for high touch surfaces, and especially between uses of materials that have to be shared. And then something that I think is critically important is reinforcing these health protections. So are there places that you can put signs that help to remind individuals about their hand hygiene, about respiratory etiquette, about the physical distancing, about wearing their face masks and how to use those appropriately. As much as you can have reminders around the space that people are moving throughout, it'll be really helpful for them to adhere to those practices and not have to constantly remember to do things themselves. Schools often have very cluttered walls, so be mindful about whether or not you need to declutter in order for those signs and messages to draw people's attention to them. And then also be mindful about how to make them developmentally appropriate. So you might use more pictures for your younger children to have as reminders than you might in a secondary level. Moving on with your universal strategies, you also are going to be thinking about how you need to modify the physical layout of your school so that you can promote the physical distancing and reduce spread capability. And this will require schools to be very creative because they do have a limit in terms of their square footage. So if you're going to be using a gymnasium or a cafeteria or some other large room or space like an auditorium, in order to maximize your ability to physically distance students, then you'll want to make sure that you put up physical barriers between your student groups so that you can keep them in the size recommended in terms of maximum sizes by phase. You'll also want to think about what guides you might have on the floor to direct traffic in a certain direction and to reduce congestion so that students in common areas aren't kind of congregating in groups in a manner that you don't want to see. Again, we want to establish small static groups as much as possible for teaching our students when they're physically in the building. And this is another good way to minimize or reduce the spread capability because each child will have less contact with other individuals, or will reduce the number of individuals that they're in contact with for an extended period of time and regularly. We want to especially do this for the younger grades because they're going to have more difficulty maintaining procedures with their face coverings and then certainly keeping their physical distance from one another. In contrast, for some of the older children, they might have to change their group composition as they move throughout their day to different class periods. If there is a way for them to stay in their same group while they move through those periods, that's ideal, but we recognize that that might not always be possible. When we're thinking about communal spaces, such as the cafeteria, such as the playground, we will either need to close those to prevent too many individuals from congregating in them and exceeding those maximum group sizes that are recommended, or we will have to think about a way that we stagger their use so that groups that use those spaces, there can be a time to clean before another group then comes into that space. So then that would ensure that we can maintain the physical distance as well as sort of the number of individuals that are in or allowable to be in a room. This is going to be most important during drop off and pickup at school. We know that that is a high traffic time where you can have a lot of congestion and a bottleneck. So it's very important that you plan in great detail how to minimize the amount of traffic and maximize the physical distance between individuals as they're arriving at the school and leaving the school. Many times schools have very well planned out and elaborate pickup plans that already stagger students being picked up and are set up in an easier way to maintain that physical distancing. So you might want to think about having something similar at drop off so that you don't have that bottleneck at the front of the school. And then finally, you always want to think ahead and be tracking the supplies that you're using so that you can make sure that you're replenishing those supplies well in advance. We will be using a lot of cleaning and hygiene type supplies, so we do need to be prepared for that. In particular, it's going to occur that a student or a staff member forgets their mask on one day or another. And so having additional face coverings on hand at the school that can be used is going to be critically important. So this is an example health screen that could be used to help you determine whether or not an individual can safely come into the school community on any given day. What is recommended in the Strong Start 2020 is that you really do want to screen for primary symptoms of COVID-19. So a high proportion of individuals that become symptomatic and test positive for COVID-19 and have a cough, shortness of breath, or a sore throat. So if an individual indicates one of these things, then that's definitely a flag that they are someone that should be isolated for further examination. There's also some indication that if individuals have two or more of the following, they are individuals that you'll want to pay attention to and isolate and have go get tested or quarantine. So this would include fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, or new loss of taste or smell. So each school will be making their own health screening questionnaire. I highly recommend that you consult with the Office of Public Health or local public health experts to design the one that's going to be the best fit for your school. So we're going to move into our Tier 2 public health and safety strategies that will be applicable to some individuals. These are going to be strategies that reduce or mitigate any spread within your school building. The first one is to implement flexible sick leave policies and practices as needed. This is going to be really important so that it discourages people from coming into the workplace while they have any symptoms or are sick. It also will be important because individuals might be caring for those who have tested positive and therefore are regularly exposed to them. And so you also wouldn't want them coming into your school community and potentially having any kind of viral spread occur. You want to monitor for the absences of both students and employees. In a moment, I will talk to you about how this is very useful data. We regularly monitor this data as a school community, but it's going to be a unique data point for us to pay attention to because it can give us some indication of some public health needs that we wouldn't normally have thought about. You want to make sure that students and adults understand that regardless of their illness, they should be staying at home. This is important for those that you have in the building that are already vulnerable from a physical health perspective. This is also important because none of us can self-diagnose why we have a stuffy nose today or a sore throat today, or why we're feeling a little bit off. So it's very important that people stay home and follow the recommended procedures so we can make sure that we're reducing any kind of risk being brought into our school. We want to make sure that we're educating staff and families about reporting to the school in regards to their exposure or their or them testing positive for COVID-19, and then being clear for both cases of COVID-19 and contacts, when they should be staying home, what that should look like, and then when they can return to the school community. And I will say really quickly related to that last point, there's going to be contact tracing that's done by the Office of Public Health from the state. But that data is very much going to be informed by what they actually receive. And so they might not have the level of detail or all of the knowledge that they need to do contact tracing as comprehensively as possible. So it is very important that your employees and families communicate with you directly about their exposure and positivity to COVID-19. From the contact tracing standpoint, they do kind of map out what home isolation or quarantine should look like. So you'll want to be informing your families that they should be in a specific room and away from others as much as possible. They should use a separate bathroom or have cleaning between use wherever possible. While they're staying at home, they should be covering their cough and sneezes, monitoring any changes to their symptoms, making sure they're getting plenty of rest and staying hydrated, and of course, washing their hands frequently for at least 20 seconds using hand soap. And then, of course, avoiding sharing personal items also within the household and having regular more intensified cleaning within the household is all important measures to help them return to the school setting with minimal risk. So as I mentioned, contact tracing does occur from the Office of Public Health. Some things that can impact the comprehensiveness or even the efficiency at which they can carry out this contact tracing can be them missing reaching families, families having a hard time recalling specific people that they came into contact with, or having a lack of understanding about what information they need to communicate and why. So again, making sure that you can do some follow-up contact tracing as necessary in your school building will be important. You want to have isolation and safety transport procedures for those who are sick. So this is going to occur when you do your health screening and individuals fail criteria from that health screening. So how do you isolate those individuals right away and get them back home as quickly and as safely as possible to reduce any kind of spread of infection? This also will occur if you have employees or students that become sick at some point during the day. And so how do we identify those students quickly or staff quickly and isolate them, clean and disinfect anywhere that they have been or any materials that they have used, and then of course safely transport them home to make sure that their health can be taken care of. And then finally, just ensuring that we're maintaining the continuity of education for those that have to go into home isolation or quarantine, or those that have tested positive for COVID-19 and are either in quarantine or receiving treatment. So this might require that you consult about your policies to make sure that they're maintaining students' educational rights and civil rights. And so you're especially going to want to pay attention to your students with disabilities who have individual education plans, particularly if those individual education plans have intervention activities that need to be carried out. This also will be applicable for students that have 504 accommodations, and how will that work when they are distance learning. And then this will also include continuity of education for your teachers and staff. So if they're not able to carry out their responsibilities through a distance format, and you need to have substitute teachers take their place for a period of time, how do you make sure that they have the training they need on the public health and safety protocols? How do you make sure that they have the lesson plans that they need in the format that they need, that they have access to any kind of electronic platforms that are being used? So you'll need to prepare your substitutes in a much more comprehensive way than you normally have in the past. Finally, moving on to our Tier 3 strategies that are our intensive or individualized supports for our vulnerable populations. So we want to make sure that we're offering options that limit or eliminate any exposure to staff and students that are at higher risk for severe illness from COVID-19. And we can refer to actually the CDC guidance about who are individuals that are likely to be vulnerable and what their vulnerability or risk is by phase that we find ourselves in. So this is going to be applicable again to your students that have individual education plans, particularly when they have physical or behavioral emotional needs that are outlined in those plans. It also will be applicable to students with individual healthcare plans. And then again, like I said, students or staff that indicate or have an identified vulnerability from a physical health standpoint. You want to ensure that you're protecting the privacy of people that are at higher risk or vulnerable, as well as individuals who may become infected or exposed. And so the contact tracing that is done by the Office of Public Health is actually HIPAA compliant. And so given the uniqueness of this situation, you might need to consult with someone to find out how you can ensure that you're meeting requirements under FERPA as well as under HIPAA for your staff and students. As a general rule, in most cases, the HIPAA privacy rule does not apply to an elementary or secondary school because the school either A, is not a HIPAA covered entity, or B, is a HIPAA covered entity but maintains health information only on students in records that are by definition educational records and therefore fall under FERPA. But again, it's important to confirm this in this unique environment. Finally, you want to carefully consider risks for extracurricular activities, including your athletic activities. Athletics, you'll want to refrain from contact sports and those that are higher risk. As some guidance in terms of what you should be doing related to your athletic activities, The Louisiana High School Athletic Association has a guidance for opening up high school athletics and activities. So that's a great document that you can refer to give you some guidance on this. But there are also other extracurricular activities that you'll need to take into consideration, and they should follow the same guidelines in the Strong Start 2020 that classrooms do. Band and vocal music are outlined to be able to resume in phase 3, but will need to maintain the physical distancing recommendations that are in effect for that phase. So using the prevention triangle framework or our multi-tiered framework is really great because it does two things. It focuses on health promotion and problem prevention. So it encourages schools to be proactive as opposed to reactive. And it's always easier to prevent problems than it is to respond to them after they occur. And it accomplishes this by using scientifically based strategies and practices that we know are likely to be effective, and then giving an organizational framework for them through that multi-tiered approach so that schools can allocate their resources efficiently and execute things effectively. So now that we've talked about having effective practices or scientifically based strategies, and we've talked about how we can organize them within our multi-tiered framework, I think it's really critically important to be thinking about how do we make implementation work. And if you do not deliberately attend to the implementation of all of these things, you will not reach the outcomes that you desire or achieve the goals that you have. So as many of us know, getting things implemented well is a lot harder than it would seem to be. And so it can be difficult because of the complexity, but it also can be difficult because it's very hard for all of us to change our behaviors. So to start to think about how we can be successful with the changes and the strategies we need to implement this year, it's helpful to understand that schools are systems. So a system is an orderly combination of two or more individuals whose interaction is intended to produce a desired outcome. And systems have what's called reciprocal influence, which means that each of the parts of a system influences all of the other parts, as well as the performance of the system as a whole. So if you make any changes in one part of your school, it's going to cause changes in other parts of your school. And so this is why it's critically important that you integrate all of the efforts and activities you need to execute into one system so that everything works together toward reaching your overarching organizational goals. Additionally, it's important to understand what supports organizational or systems change. So first, you really need to have familiarity with the principles that govern organizational change. So to be successful, you need to have knowledge and skills related to both what are effective intervention strategies that we should be carrying out to achieve our goals, and also how do we shift previous practices to new practices successfully on an individual, group, and system level. You also want to understand human behavior from a social systems perspective, because people make up schools. A school is considered a social system, and there are no two schools that are functionally alike. This is important to understand because each school will really need to do its own detailed planning in order to have success in implementing the public health and safety protocols that it needs to execute this year and following the broader Strong Start 2020 responsibilities. It's also important to use collaborative planning and problem-solving procedures. Collaboration really serves as a foundation for facilitating systems change because it makes sure that all key stakeholders are fully informed of the changes that need to be made. They're included in that process, and you're giving a structure or a framework for everybody to work together and to systematically plan and problem solve along the way to achieve goals. And then finally, it's important to understand that schools are a living system. So in order to create the changes we want to see, it's not a one moment in time activity. It's one that requires us to constantly adjust to changing information inside and outside of our building so that the school can effectively adapt as needed to continue to work toward all of its aims for the year. So in further understanding schools as systems, it's important to understand how schools can be successful, and that is when they're operating as a healthy system. So healthy systems can analyze the problems at hand, and then they can solve them to facilitate the goals that they have. And the way that they effectively are able to do this is because they can screen environmental information appropriately. So healthy systems take both the information from within the building and the information from outside the building. They identify what is relevant and important to accept and respond to, and what is irrelevant and not a priority that should be discarded or put aside. Generally speaking, when schools lack the capacity to meet the task at hand, it's because they are either too closed, which means they're not open to accepting important information, and then therefore they don't respond to that information. And when this occurs, pressure builds up in the system and there's a crisis, and the school is forced to respond in a way quickly and in a way that wasn't well planned, so it generally will be ineffective. Or they can be on the other end of the continuum and they can be too open. So these schools are overly focused on their responsiveness to an extent where they aren't able to tease out what is information that should be prioritized and what is information that should be set aside. And so they end up becoming overwhelmed and poorly operate because they are in this constant instability where they're continually in a response mode. This can lead to a depletion of energy and resources as things are directed towards things that are not a priority. And so it makes it exceedingly difficult for these systems to set goals, make plans, and attain them. So we have our scientifically based strategies from an academic, behavioral, emotional, and public health standpoint. And we have those strategies pre-planned for universal, targeted, and intensive need. But in order for us to actually deliver them effectively, there are 6 key features that should form the foundation of our prevention cone so that we can have success in integrating our multi-tiered response. The first of these is administrative leadership. It includes the behaviors and skills required for guiding a group to achieve goals. The second is collaborative planning teams. So operational planning is best performed in teams. The third is use of science-based research and information. Again, it's so important that we do use the best available science because this increases the confidence and trustworthiness of the information, and it also increases the likelihood of us achieving our goals. The fourth, is 3 tiers of intervention strategies. This ensures that there is appropriate allocation of resources. So resources are used in an efficient manner. And also it ensures that we match the intensity of intervention strategy to the individual need of students and staff. The fifth is data-based decision-making. So this is something we're very familiar with doing from an academic standpoint in schools. Using data to inform decisions increases the probability of making the right ones. And the sixth is training and implementation support. So experience and research tells us that training and hoping for the best doesn't work. So it's important to build and maintain the implementation capacity within a school. And I will talk to you in a little while about how we can best do that. So starting with our first key domain of administrative leadership, leadership is so important from a lot of different standpoints, but certainly leaders have to be active participants for a change effort to occur. So leaders play a critical role in creating the conditions that are necessary for a change. This is often due through the removal of what we call implementation barriers. So they might be removing inadequate planning time and staffing. They might be removing a barrier related to inadequate square footage in the building to have the physical distancing. How can we use our larger spaces in the building or even outdoor spaces to address that barrier? And they also facilitate change because they can provide implementation facilitators, such as increasing access to needed materials and resources, or investing in their staff and in terms of professional development and technical assistance or ongoing support. There's no one that can take this large task on alone any year, and certainly not this year during the COVID-19 pandemic. So it's critical for leaders as decision makers and those that have authority to kind of keep things moving to think about how they can delegate some decision making and oversight responsibilities so that they are not spread too thinly and things can effectively move in an efficient and real-time manner. Effective leaders also articulate clearly what is needed to be done. They establish that sense of urgency that we all need to mobilize right now to meet the task at hand. And then they help to maintain everybody's focus over time on the change effort that actually needs to be executed or implemented. And this is really important because there are so many things that can come up throughout the course of a year or day to day that can distract us or have us lose focus or get off course. So effective leaders can delegate because they, are able to identify kind of who are those people that can support them with the efforts in the building and moving things forward. And they are ones to establish sort of the relationships that are needed within the building, the mutual respect and responsibility, and most importantly, the mutual trust that helps everybody move things forward. And they also sort of set the stage for how to have open, honest lines of communication so that issues can be brought up and troubleshooted as needed. So moving on to the collaborative planning teams, we know again from experience in and out of schools that operational planning is best performed in teams. So it's critical to involve all key stakeholders. This ensures everyone is operating on the same page towards the shared goals. It's also very important because each stakeholder has a different role within your school community and a different perspective that's going to be very important for putting together a plan that's most comprehensive and useful for achieving what it needs to. Failure to involve important stakeholders often is something that leads to challenges with organizations being able to change in the ways that they need to. So you'll want to identify the core planning teams from an academic standpoint, a behavioral emotional wellness standpoint, and then certainly from a public health and safety standpoint. And in order for these teams to be most effective in their operational planning and in supporting the execution of those plans, they'll need a common framework that they can use that helps them to work together most effectively. And that common framework is going to be your data system structure, which I'll talk about in a moment, because that's really going to be what helps them to respond in real time and be able to adapt and adjust as the year progresses. So you'll want to define what each team member's role is and what their responsibilities are, as well as determine what their meeting schedule is and the frequency at which they should meet in order to effectively execute their activities. Traditionally in schools, the individuals that form our teams include administration, general and special education teachers, support personnel like school psychologists, school social workers, speech language pathologists or reading specialists, and parents and students wherever possible. As time is often the #1 barrier to planning for the implementation of new procedures and practices, as much as possible, you will want to use your existing team structures and modes of operation, and I will talk in a moment about how you can most effectively do that. Finally, I think we all recognize that change is something that's difficult and uncomfortable and aversive to people. And so it's important to realize that there are different stages of concern that you can help people move through so that you can successfully get what you need done. So the first one is how the change or the new activities are going to affect the person personally. So what are some things that you can attend to that will minimize the personal stress placed on individuals so that they can be in a more ready state to take on the new challenge? The second is concerns about how they implement the new strategies or practices. And so to overcome this concern or barrier, this is where you'll want to provide them with appropriate training, appropriate resources and materials, and ongoing technical assistance and support so that they can feel confident that they can do what it is being asked. And then finally, they'll have concerns about the impact of these changes on the overall school and its functioning. And so being clear about how you're integrating these new strategies and approaches into the overall school responsibilities and activities and how everything's working together to fulfill what schools always are doing, which is doing the best they can by students and families, is going to be important for addressing this final concern. So it is helpful to think through how regular school operations and responsibilities fit within a crisis response system. So generally speaking, it's better to have your crisis response framework in place before a crisis occurs rather than building it in the actual moment of the crisis, which can be very overwhelming and challenging to do. The federal and state government use the National Incident Management System to manage emergency incidents and disasters, and it is based on the Incident Command System that you see here, and it is flexible to respond to all different types of incidents or what we would consider crisis events. So the National Incident Management System really helps you to take a uniform and systematic approach to crisis response that's going to use the same framework and terminology that your agencies outside of the school use in emergency planning and response. So this is a really good way to most efficiently and effectively interface with your other emergency responders that are outside of your school building. So you can see that the incident commander that is the one that sort of oversees and initiates mobilization of this whole effort. This is typically the principal, as the principal is often the one responsible for the overall strategy and functioning of the school. Underneath the principal, you have the public information officer. This person prepares updates for the community regarding the status of the incident or crisis event. And then these can be reviewed by the principal or the incident commander to approve before they're released. Sometimes schools will use a communications teacher or a school librarian who has communications training. You have a safety officer, which may be your assistant principal or vice principal. The safety officer advises the incident commander on all matters regarding incident safety. In some situations, your safety officer can also be your school resource officer that's going to assist with the monitoring and implementation of safety procedures. You have a liaison officer, which is sometimes your school social worker. This liaison officer assists with being a point person or representative of the school with other organizations that you may need to work alongside to meet the task at hand. So the National Incident Management System actually has 5 or 6 functional sections. It has obviously the incident command, who sets objectives to manage the entire crisis event. You have the operations section, the planning section, logistics, and then finance and administration. So these 5 are the ones that are most common to all crisis events. In some crisis events or incidents, you will have a 6th function, which is the intelligence and investigations. So the incident commander is responsible for all efforts and develops the overall strategy and objectives for the crisis response. They may also choose to manage any of the other sections, or they may delegate these responsibilities to what are called section chiefs. The operations section, which I will go into more detail about in a moment, is responsible for all of the tactical operations. And this is going to include directing the resources to carry out your multi-tiered system of supports and your incident action plan or your crisis response plan. Your planning section is responsible for developing that incident action plan or crisis response plan to get us all working together and accomplishing what we need to respond to initially, but also updating that plan as necessary for the next operational phase or phase of the crisis response. And so you may have your COVID-19 point of contact be a part of that, because you're going to need to interface with people in the broader community, such as the Office of Public Health, to guide how you might need to make adjustments based on changes in the environment. The intelligence and investigation section, they take on the task of collecting, evaluating, and disseminating information related to the incident. There's going to be a lot of data that needs to be gathered from within the school and continually monitored from outside the school. So you may want to have a separate section, the intelligence investigation section, for this particular event. Your logistics is responsible for locating and allocating resources that are identified in your plan. This might be supplies that you need for your school, for cleaning or for hygiene, or other items, medical support, facilities support, and food or transportation support. Your finance and administration section is responsible for the administrative and financial support through the incident. Obviously, there's going to be a lot of unanticipated and new expenses during this time when we're having to respond to this biological threat. So because the operations section of the incident command system is responsible for all tactical operations, it is really responsible for what we would refer to as in the field response. And so it makes the most sense for your regular school operations and responsibilities to be integrated under this section for your crisis response. And this is particularly needed in crisis events such as the COVID-19 pandemic that occur across an extended period or duration of time. Because unlike crisis events that are very short-lived, your regular school activities are going to become very much a part of your crisis response itself. So for example, when we're in a crisis that occurs over an extended period of time, part of our crisis response is going to be ensuring that educational continuity, which is going to overlap with the normal academic supports and instruction that a school carries out. Similarly, when we're in an extended crisis, the normal behavioral emotional supports that you provide with your school are going to have a new component that overlaps, which is your psychological first aid activities. To get a better understanding of how this will work during COVID-19 this year, from the behavioral emotional support strategy perspective, you are going to need to pay attention to the psychological first aid needs of your school community, both staff and students. So psychological first aid aims to reduce the psychological distress that are caused by a crisis event, and it promotes psychological recovery, resilience, and healthy coping. And so this is something that you will be attending to as your students and staff come back to the building and thinking about how you can best support them throughout the year. Consistent with this, the Louisiana Department of Education has provided a guide to supporting the wellness and well-being of students and staff as part of Strong Start 2020. And They outline 4 principles to pay attention to. 1, acknowledge and address the unique end and start of the school year, because that was disruptive to people's regular routines, which can increase anxiety. 2, prioritize positive intentional relationships. As part of psychological first aid, it is critical that we enhance and activate people's social supports. 3, you want to address individual students' needs. So making sure that we're paying attention to those that are at risk or showing more challenges in responding to this crisis. And then 4th, we want to respond to student behavioral and emotional well-being with appropriate support. Psychological first aid is something that you want to make sure you're applying with an appropriate level of intensity. If you over-respond or provide too many supports that are not needed for an individual, you can actually undermine their healthy coping response. So moving through our tiers, we obviously have our scientifically based strategies that we give to all students from an academic instruction standpoint, as well as from a social emotional learning or a school-wide positive behavior interventions and supports standpoint. We are screening all of our students to see if they're meeting academic proficiency using our benchmarking, or we're screening all of our students to see if they are meeting behavioral expectations and are showing emotional wellness through our mental health screening efforts. This then will identify kids that are at risk or are struggling and are not getting enough support from these universal strategies. And so this information will get passed along to our teams that will help to mobilize our effort. And so if we're noticing that there's a problem with students responding to reading instruction at a singular grade level, then that grade level team might come up with a plan to address the reading challenges that are occurring across the first grade. Or if we notice that there's a problem in terms of emotional or behavior support that's school-wide, then your school wellness or PBIS team can come up with a way to address that on a school-wide level. You also have your school building level committee teams that we're all familiar with that will use data when individual students are identified with a need so that they can enter the response to intervention process. And then when they're not responding to those tier 2 supports as identified by your school building level committee teams and the RTI process, then they might actually be referred to special education to go through an evaluation to determine if they're eligible for services. And then certainly you'll have students that are already eligible for services that are going to need intensive support during this more challenging time. And again, your public health strategies are going to flow in a very similar fashion. The one thing I want to state is it's very critical with your public health strategies as well as your other strategies that they are pre-planned. So you already know what you need to do at what intensity for who as people are identified as having a need. So moving on to use of science-based research and information. Again, using the best available science will provide the greatest confidence that your hard work and efforts will pay off. Doing so is also a due process protection, which is important for schools to consider. So it's critical that we're using these scientifically based strategies from an educational and a public health standpoint. We also need to be thinking about, as school decision makers, how we can closely monitor new and changing information from the Center for Disease Control and from the Louisiana Department of Health so that we can best manage our risk in real time and make adjustments as necessary. Again, having maybe a COVID-19 point of contact that heads up your intelligence section might be useful for helping you as an administrator make real-time decisions. So you'll be monitoring scientific data about COVID-19 transmission and severity in children. This will be super important because we have much less information about the rate of infection and the rate of transmission in children. And we don't know as much about how the virus operates differently across the developmental ages or stages of children that we serve. So staying up to date on this information will be important. You'll want to continually consider the local situation, including the epidemiology of COVID-19, where the school is located. And there's great information that can be found on the Louisiana Department of Health website that gives you up-to-date information by parish. You'll also want to ensure the school's ability to maintain COVID-19 prevention and control measures. This will not only mean making sure that you keep adequate supplies, but this will also mean having to provide continual technical assistance, support, and training as you have staff that may be out for periods of time while you're trying to respond to this continually. So let's think about or walk through when somebody becomes positive, a positive case for COVID-19 in your school. So this example will focus on a school staff member. And so during the third week of in-person instruction in the school, a second grade teacher tests positive for COVID-19. She did not have any symptoms before her test results, but once the test results were received, she immediately went into a 14-day quarantine, which is what is outlined in the Strong Start 2020 document currently. The Office of Public Health notified the school of the positive result and started contact tracing throughout the school. So it's critical to plan in advance how you will effectively communicate in this kind of real-time information to your school community. One of the first questions you want to consider is how will staff and students be informed of the positive case? Although you might hesitate to communicate each positive case to the broad school community, you'll want to be mindful of two things. One, contact tracing may or may not be happening as efficiently and as effectively as you would like by the Office of Public Health. So it'll be important to supplement or follow up on that yourself within your own school building. And two, a lack of communication often results to rumors being spread, and it generates anxiety and confusion. So it's best that you control the message by having a clear way of communicating these cases and how you as a school respond to them to ensure to mitigate or reduce risk. You'll want to think about what measures are in place to contact exposed individuals and whether or not that will be handled solely with the school or a state agency. Again, I think it's best for the school to take control of this as much as possible so that they can ensure the safety and well-being of their school and be fully informed of all the important information they need. Then you'll want to think about what measures are in place to ensure a safe environment if someone tests positive. So obviously, if this is somebody that is currently in the school building, they'll need to be isolated and transported home safely, and any space that they've used or materials that they've used might need to go through a deep cleaning. And then finally, what measures must an infected individual take to return to the school environment. So you'll want to be as clear as possible, super explicit about what is required to return to the school environment. Are you going by the CDC guidelines? Are you requiring a full 14-day quarantine as is currently required by Strong Start 2020? Do you need an actual doctor's note that indicates that the person's no longer infectious or doesn't actually have COVID-19 but was only exposed to it? This needs to be very clear. Moving on to key point 4 for setting a foundation for effective practice. You have your 3 tiers of intervention strategies. The better the intervention strategies selected, the more well they are executed, the less resources that are going to be used up by your system and the less decision making that's going to be required to respond to problems, because you'll be avoiding problems as opposed to constantly having to be in response to them. So I can't stress enough how critical it is to ensure that you are implementing consistently your Tier 1 universal public health strategies as a first line of defense. And then following this, using your objective data to guide the decisions around what individuals are at risk or are struggling and need to have further attention given to them and supports. Finally, using your data systems to really inform those decisions in real time and help you to effectively allocate your resources and coordinate your efforts. And to ensure that these things happen, it's a recognition that it is hard for us all to change our behaviors. And so to achieve the behavior change you want to see, whether it is in your students or in your staff, that requires deliberate attention. And it requires you to understand behavior change principles. So one of those behavior change principles is how can you use antecedent strategies or cues that will prompt the desired behavior you want to see so that people don't have to rely on their own memory? How can you ensure that you actually directly taught this? So not only described or provided instruction as to what you want to see and why you want to see it, but modeled what it should look like. And then after that, when they were engaging in the behaviors, actually provided consistent feedback as to how correct or incorrect their execution of those public health strategies were. Whenever possible, we want to reinforce or provide encouragement and acknowledgement for people that are being successful in executing these public health strategies, and correction when it's required so that they know how to make adjustments in their behavior. If you're a school that's using positive behavior interventions and supports, you can build some reinforcement in engaging in these public health measures through that system. And it's important to remember when giving correction that it is hard to change behavior and people are often not intentionally not being successful. So being positive and encouraging is the best way to go. So you'll want to think about what are the essential components for executing your 3 tiers of strategies. Again, making sure that you have a pre-planned sequence of strategies and that you give them an adequate supporting infrastructure, which includes the data system structure that will drive the decision-making and the response efforts. that your universal strategies are implemented and you have screening or monitoring to identify those that have additional needs, that you are taking your data on a regular basis, a very high frequency basis for your public health data, and of using it to evaluate the effectiveness of your strategies at the whole school, grade, class, and student levels. And that you also can speak to how well things are being implemented so that there can be some accountability and you can troubleshoot implementation challenges as they occur. So moving to data, which is so important. Specific data sources can actually be used at larger units of analysis to identify the needs for your school. This is very important because oftentimes we think about using data on the individual level that's collected, and that is very resource demanding to respond only on an individual level to individual needs. So by looking at your data at larger units, you may see that you need to make some changes in the whole school that will reduce the number of individual students that are showing a need, or you may see that you need to apply resources to an individual classroom as opposed to the whole school, because there's a lot of kids being identified in an individual classroom with a need. Once needs are identified, of course, we want to mobilize those resources that have been pre-planned, those strategies to address those needs. And then, of course, it's essential that we have progress monitoring data to see if those supplemental supports or those additional or individualized strategies are effective at meeting the needs. So it's critical that we use this data to determine the individual needs and those that need a less intensive strategy, which would be a tier 2, versus a more intensive strategy, which would be a tier 3. I'll be talking in a moment about how we as school professionals can not only do a great job of collecting a lot of data, but do a better job of organizing and synthesizing it so that we can make sense of it to use it towards reaching the outcomes that we want to see. And so part of that is recognizing that data is gathered with tools that are meant to answer questions or to fulfill specific purposes. So you want to start with the outcome or purpose in mind, and then select the appropriate tool to get the information you need to meet that purpose or to know about that outcome. So effective data systems have a few qualities. First, you need to think about the overall structure, not only the tool that you're using to gather data or the method or procedure that you're using, but how is this data then going to be organized and synthesized and then made sense of in order to make decisions with it. And so good data should inform the selection of the type and intensity of intervention strategy needed, as well as who needs that strategy. So good data is going to actually serve a very specific purpose or answer an important or specific question. It's going to be data that is trustworthy, so it's technically sound or accurate. It's going to be data that you can collect very efficiently with the limited resources and manpower that you have, and it will be easily convertible into graphs or some other summary that you can make sense of. And then finally, this data is going to be really useful for making specific decisions for supporting individuals. So there's two methods in designing your data system. The first is selecting measures specifically for the purpose. This is the most time and demanding and effortful way, but it will give you the most useful and accurate data for the purpose that you're needing it for. The second is identifying tools or measures or data that you already use in the school and using that. This is the most efficient, but it may not give you as useful or accurate data for what you need it for. So really the best approach for most schools is to integrate the two. So you first want to identify what data you already collect, and to the extent that it answers the questions you have or serves the purposes that you have. And then you want to fill in the gaps by selecting measures that are highly efficient and interpretable and technically sound, so that you can best make decisions for your school community. So creating a framework for your data system includes who is going to collect the data, who is going to enter, organize, or synthesize this data, how this data then gets analyzed, then how we make decisions based on what we interpret from the data, and then once those decisions are made, how the action plans for those decisions are initiated and monitored and followed up on. So the one way that we'll need to think about this a lot this year is how to use data to make our school-based public health and safety decisions. So again, you're going to use your two methods. You're going to start with what is data that schools already gather. We all gather absences for both staff and students. And this is going to be critical information, because if we start to see a lot of absences pop up in a particular classroom or throughout the school, and we don't really have clear knowledge as to why, that might be a flag that we're having some community spread within our school. We're also going to have our new instruments that are going to give more specific and accurate data related to COVID-19. And so that's tracking any individuals that fail criteria on a health screening or have been exposed because they had direct contact with someone that tested positive for COVID-19. That's also going to be tracking those individuals who report that they did test positive. So in addition to this information that we're going to be gathering on a consistent basis or a daily basis inside our school building, we're going to be monitoring the important external community spread data that can be found on the Louisiana Department of Health website or through our contacts with the Office of Public Health. And alone in combination, these data can be used to make decisions for our school. So as an example, if we have evidence of widespread community viral transmission, and we also start to see evidence that there's some widespread going on in our school. So instead of just seeing exposures or a positive test result for an individual in one classroom, you're seeing this in multiple classrooms or sections of your school building. In this case, Strong Start 2020 recommends that schools have prepared plans for school closures of 3 to 5 days for deep cleaning if the school environment is determined to be a source of ongoing COVID-19 spread, which this data or these data may suggest. But say you have a plateau in community viral spread, or even a declining trend in your community viral spread, but you see some indication that there's spread within a single classroom or a single section of the building. So for example, you have several of your cafeteria staff call in because they've been exposed or tested positive, or you have multiple individuals in a single classroom. This may mean that you need to consider that single classroom going all virtual temporarily until that sort of spread within that classroom is contained and people's health and well-being is taken care of, and you've gotten some deep cleaning of that classroom environment. Or you might need to close a section of your building for deep cleaning, such as the cafeteria, if you have several staff from that area that call in. And then finally, if you have a plateau or decreasing trend in your community viral spread, maybe you don't even have any cases at the current moment that are popping up regularly in your community, but you have a single student in a small static group who has tested positive. So in this case, you're most likely not having to have a strategy to respond to the whole classroom or the whole school, but you'll want to isolate that individual and have them go into quarantine, make sure they're getting their educational continuity, and then contact trace within that classroom for the staff member or the few students that that one student has had prolonged direct contact with. And of course, in these cases, you want to be clear about what a home quarantine should look like and what is required to return to the school community. No matter the level of community spread or the cases that you're aware of locally, it's going to be very important to give more weight to your in-school data, because it's possible to have cases pop up, exposures or spread in your building that are inconsistent with what's going on in the community, particularly if a family or staff member is to travel somewhere where there is spread and they might bring the virus in unknowingly. So finally, training and implementation support. All too often, we are being asked or mandated to do things that we don't have the resources and the support to do effectively, which is why we really have to be detailed and deliberate about our planning and supporting efforts. And there's some common elements that you'll want to attend to. First is addressing people's beliefs, attitudes, and knowledge related to this crisis event so that you can have the buy-in and the understanding that's needed. And so this often relates to either misinformation that people have, but also certainly their personal concerns with being able to carry out these activities, and how can you reduce their burden or stress load so that they are able to actually engage in what you would like them to. Building those necessary skills through professional development. And this includes the provision of direct training. So direct training always has 3 components and is what is going to lead to more successful behavior change. Didactic instruction, where you're describing in clear detail or teaching about what you want to see. Modeling, where you actually show what you want to see, what it looks like, and then feedback on how successful people are in engaging in those behaviors. And ongoing support is really critical too to this, as well as supplying necessary resources, because this is going to address the second concern people often have, which is not having confidence in their ability to execute these new practices or strategies. And then of course, finally, having it in this integrated system where they can see how everything is working together efficiently towards all the aims of the school will address any remaining concerns. It's important to recognize that if you are not aware of how well or consistently things are being implemented, you're not going to be able to make accurate decisions with your data. So as an illustration of this, it's important to have awareness of both your implementation integrity, or the degree to which people are carrying out what they're being asked to do well and consistently, as well as your information on your public health, academic, and behavioral emotional outcomes. So if you're seeing the outcomes with your data that you want to see, but you also know that things are being implemented consistently and well, then you know that you just keep doing what you're doing because it's working. However, if you're getting the outcomes you want to see, but things are not being implemented correctly or consistently, you don't know why you have those outcomes. And in this public health situation, you won't be prepared if there is an exposure or spread that seeps into the school. Those things aren't in place to prevent or mitigate the risk from that. If you're not seeing the outcomes that you want to see, but you have implementation, that lets you know, okay, we need to do something different. The public health strategies we have in place for our vulnerable staff and students is not sufficient. So we should be changing those. Versus if things are not being implemented and you're not seeing the outcomes you want to see, you don't know what is the right thing to do in the moment. And so you won't be able to address that problem as efficiently, and you can lose valuable resources and time. Finally, as I stated, schools are going to have to constantly adapt in real time over the course of the year. So in addition to those foundational pieces that help us to integrate our academic, behavioral, emotional, and public health strategies, the glue that holds everything together is the collaborative strategic planning, or a cyclical problem-solving process that we will be using through our teams as they process the data that they are taking in. So this is very similar to the problem-solving process that schools regularly engage in. It begins with understanding what is the situation, identifying that problem or the threat, being clear about what the discrepancy is between what we want to see and what we're seeing, then moving to determining the goals and the objectives after we have analyzed how far off of what we want to see we are, and then moving into coming up with a plan for how we can address the current situation and respond to the incident, and then making sure that that plan is reviewed by all that need to execute it, that it is well thought out and written and clear so that it can be implemented. And then finally moving to its implementation and evaluating how effective that implementation was in responding to the problem. And so throughout the year, you will be cycling, your teams will be cycling through this effort. What is the current situation with the academic proficiency of our students, their behavioral emotional wellness, or our public health of our school? What are some goals and objectives we need to have in the moment based on how far off or close we are to what we want to be seeing go on? Is our plan working? Are we tweaking our plan to address a current need that has come up? And have we put together clear action steps and allocated resources and personnel to execute them? And then how are we monitoring its implementation and how well it's working over time? Finally, summarizing the presentation today, we use the prevention triangle as a framework for us in our response because it allows us to prevent problems before they occur and have less to respond to, so it's proactive. We are integrating our public health efforts into the three-tiered approach that we commonly use in schools to help everybody see how everything is working together. We are using scientifically supported universal strategies, whether they be academic, behavioral, emotional, or public health, so that we can have confidence all of our hard work and efforts will pay off. We are understanding the need to respond and adjust to changes within the school and outside of the school, and that'll be a cyclical process that our collaborative planning teams will engage in to help us troubleshoot or problem solve along the way. We are recognizing that there are 6 key features to integrating all of our efforts across the different responsibilities we will have this year. And we're having a recognition that for future crises, if we don't have this set up already, it is great to use the incident command system structure, because it is what all emergency management planning and response individuals use on the state and federal level. So this will allow us to be prepared for future crises and to integrate our regular school responsibilities with a crisis response, so that we can be as effective as possible in serving all of the needs within our school community.